Dr. Moyer, how's it going? It's Taylor Cook. So basically I have to redo this video. I'm going to try and make it shorter, but like I said, going off my outline, I used the objectives of the class and I kind of answered them, um, and I feel like that's a good indicator of what I've learned in the class. So for objective number one, develop an awareness of contemporary health issues of importance to individuals working with a school-age child. I said some issues would be mental and emotional health, healthy eating, physical activity, safety and intentional injury prevention, personal health and wellness, violence prevention, tobacco-free lifestyle, alcohol and drug lifestyle, and sexual health. For objective two, which is understand national and international public health and safety issues, I said that global health concerns are not all about infectious diseases, but they talk about diabetes and obesity, mental illness, substance abuse, and substance use disorders, including tobacco and also injuries. Um, the CDC identified 6 priority health behaviors to guide educational programming, but I think that these are some key issues such as tobacco use, poor eating habits, alcohol and other drugs, behaviors resulting in intentional and unintentional injuries, physical inactivity, sexual behaviors resulting in HIV or any other STDs or pregnancy, and obesity, I said, seems to be a very universal health concern. For the third objective, which is understand health facts, principles, and family and community health for school-age children, I said that the school is an agency of the community and it can't function effectively in isolation. Um, I said children in school are influenced by um, practices in neighborhoods, churches, stores, medical care settings. Um, I said that research confirms the need for local districts to establish a school health advisory council in order to reduce the duplication of services, enhance the visibility and potential impact of participating agencies. They need to pool resources, identify gaps, cultivate community relationships, and I said most activities related to family and community involvement in school health programs are based at the local level and not the state level. Um, for Objective 4, establish and monitor personal and family health goals. I said a student and their family can create a set of health goals for them to achieve. They can work together to create these goals and come up with a way to monitor such activities, such as creating a chart and putting a sticker next to your name every time you do something right or you reach a goal. And you can keep track of your progress that way. Um, For Objective 5, identify reliable sources of health education, information, resource materials, and increase health literacy skills so as to make appropriate health-related decisions. I said um, reliable sources of health information um, are basically any materials written by the government. Um, Anything that's produced by the government is going to be fairly accurate, I would believe. Um, I also said you can use local resources such as your doctor, or you can go to hospitals, and just any place that has like healthcare, and talk to the professionals there and get information from them. Or you could go on a reliable website such as um, like WebMD. That's a pretty good website, I think. Um, you can go places like that also. For Objective 6, examine the relationship between personal behavior and health status of the individual and the community. I said that there needs to be a balance between the domains of health. And I used like the Loka wheel as an example. And basically I said if balance is thrown off in one aspect of health, then it can lead to the other aspects being thrown off as well. So for example, if a person smokes cigarettes, that can um, that's their personal behavior, and that affects their health status by in the future potentially um, being a reason for getting lung cancer, and then if they die from that, then that can affect the community, or also smoking can affect the community just through secondhand smoke. So all three of those are intertwined, and if one of them is thrown off, then the rest can be thrown off. For number 7, Objective 7, which is develop an awareness of the importance of health and health education in improving the quality of life. I said a person's quality of life goes hand in hand with what they know about health. The more one learns about health, the more one can turn their life around to be healthy and positive. I said a physically and mentally healthy person can lead to them having a greater quality of life. Number 8, Objective 8, I said it is utilize the state and national learning standards for health education and developing learning activities for the school-age child. What I did was I basically provided the standards for the national standards for Standard 1, core concepts, 2, analyze influences, 3, access information, products and services, 4, interpersonal communication, 5, decision making, 6, goal setting, and 7, self-management, and last but not least 8, which is advocacy. And then also the state, I provided Standard 1, personal health and fitness, Standard 2, a safe and healthy environment, Standard 3, resource management. But these can be utilized while creating your lesson plans. It provides you with like a backbone to go off of. You can use it to come up with ideas for your lessons and all that kind of stuff. So for Objective 9, identify state and national health education curricula for the school-age child. I said most of the health curricula is made up of common elements, such as a set of expected learning outcomes or learning objectives that contribute to health, promoting decisions, achieving health literacy, and adopting health-enhancing behaviors, including promoting the health of others. A planned progression of lessons or learning experiences that lead to achieving these objectives. Continuity between lessons and learning experiences that clearly reinforce adoption and maintenance of specific health-enhancing behaviors. Accompanying content or materials that correspond with the sequence of learning experiences and help teachers and students meet the learning objectives. And assessment strategies to determine if students achieve their desired outcomes. For Objective 10, discuss the impact of culture, heritage, socioeconomic level, personal health and safety, nutrition, and factors in the home, school, community, on the school-age child's readiness to learn. I said culture. There could be cultural barriers, and that can affect a child's learning. Also, a child might be made fun of about their culture because it's different from another student's. But I think mainly what would affect a child's readiness to learn is the cultural barrier, as in like language, needing a translator in the class all the time and stuff like that. I said that socioeconomic level can affect a student. Students that come from families of poverty are shown to do not as well in school. But I also said personal health and safety can affect a student. If a student is overweight, they may be made fun of at school, which will cause them to not want to go, or it can definitely affect a child's readiness to learn. And I also said that if a student is doing something stupid outside of school and they hurt themselves and they have to miss school, that's going to affect their readiness to learn, but they didn't have to do that activity. but they chose to and they hurt themselves. Another thing I said is um, nutrition and factors in a home can affect a student. Students with young parents tend to not do as well in school. Students whose parents may have gone through a divorce also might not be, they may not be ready to go to school. If they eat badly at home, they might not be getting the correct nutrients in their diet for them to make it successfully through the day, being able to pay attention and be on task and all that stuff. And I said that the community can have an effect on a student. If a student's living in a ghetto or something along those lines, a student might get involved in gangs, and that'll cause them to do poorly in school or not go to school at all. So that's what I said about community. For Objective 11, identify factors necessary for creating a safe and nurturing classroom environment that is free of violence, substance use, and where students show respect for others. I said, I gave characteristics of a healthy school environment. I said it is a place where students, faculty, and staff feel cared for and personally valued. It's an inviting, safe, and nurturing learning environment. It engages students in meaningful activities, develops shared norms, involves students in decision-making concerning school matters. And then I said school districts must consistently enforce policies managing student behaviors in the CDC priority risk areas, which include bullying, weapon carrying, tobacco, alcohol, or other drug possession, and instances of acting out. Also for a fun, safe, nurturing learning environment in a classroom, you just want to have a lot of bright colors, a lot of stuff on the walls, positive stuff, but things that can reinforce what you're going to teach. And you want to really you can create a set of rules with your students. You can work together to create a set of classroom rules. For Objective 12, which is utilize strategies for preventing alcohol, tobacco, and other drug use and abuse, I said it is important for states and districts to have a zero tolerance policy for alcohol and other drug use. Currently, 99% of districts have a policy prohibiting alcohol use by students. I said we need to enhance protective factors and reverse and reduce risk factors. We need to address all forms of drug abuse, alone or in combination, and we need to address the type of drug abuse problem in the local community and target modifiable risk factors and strengthen identifiable risk factors. Also, we want to address risks specific to populations or audience characteristics. I said family-based prevention programs should enhance family bonding and relationships and include parenting skills, and that they should provide practice in developing, discussing, and enforcing family policies on substance abuse. And you should train in drug education and information. For school prevention programs, I said that they need to be designed to intervene as early as preschool to address risk factors. They need to target improving academic and social-emotional learning for elementary age students to address risk factors with a focus on the following skills, which are self-control, emotional awareness, communication, social problem solving, academic support, especially in reading. And then I said middle and high school preventions. Well, the school prevention programs need to increase academic and social competence with the following skills: study habits and academic support, communication, peer relationships, self-efficacy and assertiveness, drug resistance, reinforcement of anti-drug attitudes, strengthening of personal commitments against drug abuse. Community prevention programs, I said, need to focus on key transition points such as transitions to middle school, combine two or more programs such as family-based and school-based programs. They need to present consistent community-wide messages in various settings, And I said that programs effective in reducing drugs by youth are the All-Stars program, Life Skills Training, and Project Alert. For learning objective 13, which is understand preventative physical and mental health measures, including proper diet, nutrition, exercise, and risk avoidance and stress reduction. I said a proper diet should be balanced. You can follow the food guide pyramid, and I said that having proper nutrition is very important. We need it to function at a high level during the day, to make it throughout the day, to stay focused. I said that you could also go to myplate.gov, and that'll give you information about nutrition. I said that we need to exercise every day. Exercise helps our mind stay sharp. Children are required 60 minutes a day of physical activity, and it is shown to enhance student performance. I said risk avoidance can be taught in class, and we can encourage health behaviors and talk about risk behaviors and how they can affect us. We can also reinforce protective factors. I said stress reduction can lead to a healthier person. Their blood pressure will come down, and we can teach different methods of stress reduction in class, such as meditation and other simple forms that can be done at home. Last but not least, objective 14 is provide instruction for the purpose of preventing child abduction. And I said that in recent years, the issue of missing and abducted children has become very popular throughout the nation through the media. You turn on the news and I feel like every time I turn on the news I see something about a child being abducted or a missing child or something like that. So the public concern has resulted in the development of numerous prevention education programs that focus on stranger danger or the prevention of abduction by someone unknown to the victim, child, and or family. So other than that, don't really have anything else. I enjoyed the class. I'm sorry about this whole final project being a pain in the butt for me, but I'm hoping that this one works. And thanks for everything this semester. Thanks for giving us feedback after we hand in the work. I thought that was really nice. I've taken a couple online classes and the teachers haven't done that, so I appreciated that. I also really liked the question and answers because it got me really thinking, and it was nice to that I could relate the questions and answers to things that I've experienced, that I've done, or that I hope to do. So I really enjoyed that. But it was a good class, and I hope this works. And thank you for being patient. I really appreciate that.